Hello everyone, good morning, good afternoon, wherever you may be. My name is James Boone and I am the Technical Sales Manager for ViewsIQ in Vancouver, Canada. Today we are pleased to present a presentation by Dr. Matthew Hanna covering the various use cases for Panoptiq in telepathology, education, and social media. Dr. Hanna is a clinical instructor of pathology informatics at the University of Pittsburgh. He completed his residency training at the Mount Sinai Hospital in New York and is currently a pathology informatics fellow at UPMC. Dr. Hanna serves as a junior editor of the Journal of Pathology Informatics, and he has strong interests in pathology and clinical informatics, as well as women's health pathology. We expect this seminar to last about 30 minutes with time for questions. Please feel free to write your questions in the GoToWebinar questions section at any time, and we will get to them at the end. Firstly, I would like to just give a very brief overview of Panoptiq before passing over to Dr. Hanna. During the middle of the presentation, we will cut back to a live demonstration of Panoptiq, where Dr. Hanna and I will show you how the system can be used for a thyroid FNA rapid offsite evaluation procedure. Panoptiq has been designed to fit within existing workflows and acts as an extension of the microscope. It allows you to image what your microscope sees with any objective in real time to create panoramic images of the entire slide in high resolution. Essentially, the system comprises a live video camera mounted to the microscope and our software. In addition, as we will discuss, Panoptiq also includes the Panoptiq portal, which is our cloud-based solution for storing and sharing slides. Now that you have an idea, basically just what the system is, I'll pass the presentation over to Dr. Hanna to explain just what the system can do.
Good afternoon, everyone. Hello, and I'm excited to discuss and show all the attendees and listeners the Panoptiq ViewsIQ system that we have implemented at the University of Pittsburgh Medical Center, and several use cases that we and others have applied in our department. I have no financial conflicts of interest to disclose, and all of the contents in this presentation are my own and not influenced by any vendor or other organization. The presentation will be divided into 4 sections, which will somewhat partition this PowerPoint so that a live hybrid demonstration of the Panoptiq system can be performed and display some of the features of the current Panoptiq 4 system. The presentation will include several clinical use cases that the pathology community, including UPMC, has utilized this system to ultimately enhance patient care and further discuss the educational and social media initiatives using the Panoptiq system at UPMC. So before we start discussing the clinical use cases, for anyone who may have not seen or worked with the Panoptiq system, I wanted to include a list of pros and cons so that they may have a better idea of what and how the Panoptiq system performs. The first bullet says that the system's familiar. The familiarity stems from the fact that the Panoptiq hardware comprises of a small camera mounted to a microscope. All of today's pathologists, laboratory personnel, or researchers should be very familiar with their microscopes and know how to operate them. The camera exists as a digital feed to the computer where the software performs the image stitching. As just mentioned, the hardware component is the point grade camera that you will see in a minute is about a 3 centimeter cubed box that is mounted to the microscope. Whereas this does not take up any other additional lab space, which is usually at a premium if your lab is anything like others that I've been a part of. This equipment and software is less expensive than others that exist on the market, mainly because it leverages the optics existing in the microscope that it's attached to, and no further robotics or engineering are necessary. The image stitching software only captures the regions of interest that the user scans, which usually results in lower file sizes. The scans typically have little to no dead space and have smaller file sizes than if the whole slide would have been scanned. Personally speaking, the system scans the image quite fast and with high accuracy, and a rich benefit of the system is the ability to capture regional Z-stacks for cellular clusters or any other region of interest. Last but not least, the system has a web-based platform that hosts the user-scanned images with other ancillary features to enhance the user's content, such as attachments or annotations. Some cons that I've encountered with the system may be considered as benefits depending on what your laboratory or department's needs are for such a system. Because the system uses a traditional microscope, there is no easy process to automate the slide scanning. This does allow the user to maintain complete control of the output slide with the Panoptiq system, so ultimately what you see is what you get, and can theoretically provide a 0% rescan rate from a QA perspective. However, this does mean a person, whether that be a pathologist, technician, or otherwise, will manually need to scan the slide, maintain proper focusing of the tissue plane, and use the microscope navigation to create the whole slide image. There has been a lab that is attached to the Panoptiq system with an automated slide scanner, but I'm not familiar with how that system had performed. Like most other whole slide imaging systems, this system exists as a standalone system and does not have direct interfacing with a laboratory information system. This is not necessarily a problem with Panoptiq, but also on the LIS vendor side, a need for better integration of these upcoming digital pathology systems with laboratory information systems. And lastly, the output slide of the Panoptiq whole slide image is an SVS slide. However, each magnification plane and Z-stack is a separate file in the folder directory. This is non-contributory for when the user views the Panoptiq whole slide image in the Panoptiq viewer or portal, and the image can be seamlessly viewed, but not all of these features can be leveraged or taken advantage of in other vendors' whole slide image viewers. So let's start the presentation by discussing the clinical use cases people have utilized the system with. So these are all of the published and presented use cases that laboratories have utilized the Panoptiq system, which include frozen section, telepathology, consultation, cytology, hematology, and microbiology. Last year, UPMC published on using Panoptiq for frozen section diagnoses. So in this study, 20 genitourinary intraoperative consultations were evaluated comparing glass slides to panoramic ViewsIQ generated digital slides to whole slide scanned images on an Imperial whole slide scanner. So the panoramic images included representative Z-stacks of the regions of interest on the glass slides. The diagnostic concordance to the glass slides, being the gold standard, were 98.3% using the panoramic Panoptiq images and 100% using the whole slide images. The file sizes of the Panoptiq images were more than 14 times smaller than the whole slide images. Time was not ultimately recorded per case, however, the author stated the total scanning time was on the order of several minutes and became progressively quicker with further experience using the system. Similarly, a study comparing Panoptiq panoramic slides with 2 whole slide scanners specifically related to challenging subspecialty area glass slides such as cytology and microbiology, as well as surgical pathology. These results showed comparable diagnostic concordance and errors between the 3 systems, with the least number of problematic images coming from the Panoptiq imaging modality. Again, the authors concluded that the Panoptiq images were technically easier to handle due to smaller file sizes, and that it is imperative to capture all diagnostic areas of significance since the Panoptiq system requires manual image acquisition. In this next publication, we retrieved 30 glass slides from cytology cases, which included gynecologic and non-gynecologic cases. and compared them to Apirio and Hamamatsu whole slide scanned images in a clinical environment for screening and interpreting cytology slides. So in this study, there was no statistical significance in the cytopathologist diagnostic concordance between the three systems, and it showed that the three systems had comparable image quality, as well as that the Panoptiq images offered a novel technology to overcome cytology focusing problems that digital cytology is commonly plagued with. However, the Panoptiq system did require a trained cytotechnologist to acquire the panoramic images and representative Z-stacks. The University of British Columbia published on using the Panoptiq system as a telepathology tool for consultation in hematology. The study examined 100 blood smears comprising of 23 different hematological diagnoses, which included diseases, reactive, or normal diagnoses. They found that 99% accuracy of diagnosis interpretation when using the system for real-time image viewing, and 91% accuracy when reviewing the static images. Another clinical pathology use case for the Panoptiq system included telemicrobiology. Telemicrobiology is traditionally very challenging due to the high resolution required to identify the very small microorganisms, and is difficult even with whole slide scanners. 20 challenging microbiology cases were selected in this study and scanned at 10x magnification and under 100x oil immersion. The authors had similar conclusions to the other studies, where they stated the Panoptiq system's benefits included having a small footprint, ease of use, generating small file sizes, the regional Z-stack capabilities, and having system flexibility. For a live clinical system, one could imagine use cases such as frozen section or transplant biopsies occurring in the field. So transplant biopsy specimens are usually sent by courier, and frozen section is performed on them at whichever hour of the day they may come. And this is to provide clinical decision support whether to transplant said organ or not. So this is ultimately and essentially a very high stakes game. So as part of a digital pathology armamentarium, Panoptiq system could be ideal to support the quick scanning of glass slides, high fidelity images, having accurate representation, meaning good quality image stitching, and easy remote viewing of the cases. So all of the posters and published studies had been using Panoptiq 3. Recently, an updated Panoptiq 4 version has been released, and in part of this presentation, as mentioned, I'll pass the controls over to James in order to show some of the features of the new Panoptiq system.
Yeah, thank you, Matt. Yeah, so at this time, I'd like to just kind of show you Panoptiq 4 live, give you just a very brief overview of the main functions here. So what you currently see is the live view from the microscope. And I'm hoping that you're not experiencing lag, or you have some good image quality at your end. GoToWebinar is not really the best program for sharing this sort of high definition images in real time, but we're hoping that you'll get a good idea of what our system is capable of through kind of good image streaming software. So as I said, this is just the live video view. And on the left-hand side, you can see the objectives on my microscope, which have been pre-calibrated at this point. So many of you are probably familiar with live video telepathology. With Panoptiq, we can take telepathology one step further by allowing an investigation of the slide in real time that is a hybrid between the immediacy of a live video view with the convenience of looking at a whole slide image. So I'll just begin that now. If I go into our scanning mode, so we're going to pretend here that basically we're doing an FNA ROSE procedure. So, you know, I've just been, if I was the technician in the FNA suite, I've just produced this slide and placed it on my microscope. So I can begin scanning at low magnification to produce a whole slide image. So I still have the live view in the main window, and you can see how I'm producing a whole slide image in the mini map in the lower right. So really at any time that I've begun this procedure, Dr. Hanna can come online and begin viewing as well. So I would just be scanning and waiting for him to come online.
So, hi James, I see the FNA has been performed and the slide prepared, so I'm ready to begin.
Oh, so that's great. I'll switch over to a dual view that we have. It's our consult mode. We are actually in the middle of developing Panoptiq to have its own streaming capabilities, so that instead of us sharing a split screen view, we will each have our own tied together full screen view working off of our own computers. But essentially, now I can continue scanning while Dr. Hanna is free to investigate the scan. He does not need to be tied to where I'm looking, nor does he need to give me any verbal commands to move the view for his investigations.
So as James completes finishing the scan of the slide that was generated from this FNA procedure, I have complete control of the right side of the screen, and I can pan around either by clicking and dragging or zooming in using the scroll bar, or also using kind of navigational tools on the mini map by clicking and holding this. And what's unique about this system is if there's a region of interest that I would like the technologist to go back and either rescan at a higher magnification as I'm panning through the slide, I can right click and drop that annotated area there, and as I'm panning around also at low power, there may be another area of interest that has high cellularity that I'm interested in seeing at a higher power. I can drop another region of interest there and continue to pan around, zoom in, and look at another area. Potentially, instead of having a higher magnification, I can drop an annotation marker to show or to generate a Z-stack in that area. And so as I'm continually panning around to view other areas, the technologist continues to perform, to scan at higher magnifications or use other Z-stacks. And for the purposes of this demonstration, I can go into the review mode, although this could happen in a live field where on that same screen. But I can go and review those markers that were dropped, that were scanned at a higher magnification, or as in a Z-stack, I can either double click on these or click using this area here, and I see that this area was generated at a higher magnification. And similar to the objective turret that's on the microscope, if you were to double click on an area, it can pop up in a higher magnification. And if I double click again, it takes me back to the lower as if I was dropping back. And I can double click on cellular areas of interest and go even into the next scanned area and also view the higher cellularity areas that I requested to be scanned at higher magnification. And ultimately, this looks like an FNA of a lymph node. This looks like a mixed population of lymphocytes, and so far it doesn't have any evidence of metastases or other carcinoma. And after I've completed reviewing the higher magnification areas, I can go to the Z-stack area, and there's a vertical scroll bar on the left that can be panned through, which has captured all of the Z-stack planes. And at will, I can go back into the highest resolution area and pan through kind of the z-planes up and down until I satisfactorily have completed a review of this area. And once I feel confident enough to go back into the scan, I can go back to the scan and either drop other markers to be scanned or to request to be scanned at higher magnification or other Z-stacks.
Yeah, thanks, Matt. So, you know, although this wouldn't necessarily have to be done, another benefit of the system in a live consult to bring out the sort of hybrid qualities of Panoptiq is that you have the ability to actually keep the scan as a saved image. So using the portal, we can upload a case to our cloud server that will begin uploading essentially right away. And you can see how you know, it's fairly quick. I will save us the seconds though and just jump ahead to a scan that we did earlier, just to show you on the portal. The interface really is familiar to the main Panoptiq software, and it allows for navigating of the slide really in the same way that we would, in the same familiar way between Panoptiq and the portal. And you know, we can jump into regions of interest through the same sort of double-clicking magnification switch that Dr. Hanna was explaining as well. Crucially for the portal, though, is the ability to share slides. So if I click on the sharing button, we can see that there's kind of two modes. The first is private sharing. So this is how you would share cases with specific portal account users. So in this case, the scan has been shared with Dr. Hanna. There's various permissions that can be provided as well to keep control of your scans. But the second method is public sharing. So with this setting, sort of kind of like a Dropbox or a OneDrive, you can send a link to a colleague through email, or any other kind of sharing service or messaging service, I should say. And then the recipient just clicks on the link and is immediately taken to the portal to view the slide. So there's no software downloads required. And since the portal is browser-based, the slides can be viewed on any device, whether that's PC, Macs, smartphone, or tablets. So within the portal, we have our file explorer. You can see the full list of scans that you're currently storing, generate links, etc. So I'll pass things back over to Matt, who will be able to really explain how he's used the portal to facilitate endeavors in education and social media.
Great, thanks, James. So next we'll move on to discuss the educational uses that the Panoptiq system can and has been used for. So since the Panoptiq portal is web-based, all the scanned cases, as you saw, can be uploaded, shared, and viewed with as many people as the user desires. So at UPMC, we have used it to scan interesting educational cases and created a repository of these panoramic images that can be viewed by distributing a case link to any other user or on a social media platform. So here, as you saw, you can share the individual case. And this is a screenshot from the web portal where additional case documents or notes such as clinical histories or other PDF documents can be added and also viewed by each user. Here's a representative list from the cases that were scanned and placed in the UPMC Panoptiq slide repository. Cases included many different subspecialties and, more importantly, were found to have sufficient resolution to display cytology and hematology cases. These two subspecialties in pathology have traditionally had difficulties when it comes to slide scanning, but the unique capabilities of the regional Z-stacking allowed these cases to be captured and easily viewed while maintaining low file sizes. And you can see from this distribution of cases, it included cytology, skin biopsies, and resections, as well as autopsy. So one non-clinical use case that the Panoptiq system was used for at UPMC that will be discussed next is the social media initiative that many pathologists, pathology departments, and organizations are also increasingly becoming involved in, which is sharing pathology cases on social media. So social media has been increasingly used in medicine. Physicians are sharing difficult cases for diagnoses, some are for educational purposes, and others have created social medical networks from their contributions on social media platforms. And social media is ultimately a conversation using online tools, whether it's text, photos, or video. And a lot of users use it either for marketing, networking, crowdsourcing. They have established communities, or just for documentation purposes. And here's a look at the current social media landscape. And there's everything from collaborative Google documents to networking on LinkedIn, sharing an image on Instagram, blogging or microblogging on Twitter due to the character limit restrictions, or sharing videos on YouTube. There's something for everyone and every need. And even in the research field, social media has been on the rise. There's been an exponential increase in peer-reviewed publications involving social media, significantly in the medical literature. And the one publication from 1960 was from a translation from the Portuguese surgical literature, and was on social media and perspective in surgery, but surely was not related to the current social media nomenclature that's understood today. A 10-year study showed the increase in social media usage by healthcare professionals and placed physicians as the #1 medical profession using Twitter. Another study from Stanford also confirmed this increased usage of social media. So they captured and analyzed over 338 million tweets from healthcare professionals, and they analyzed them and analyzed their behavior, such as the average tweets per day, the average followers each user had, the profession percent compared to all healthcare professions. It was a very in-depth study. So what did we do at UPMC? So we posted interesting educational cases on a weekly basis. These are all de-identified clinical information, and we collected data for 5 months. These cases were scanned using the Panoptiq system and uploaded to their web portal, where these cases were shared on social media, namely Facebook and Twitter pages, and analytics were used to monitor user traffic. Quiz questions were also generated to poll the audience and provide further feedback on the diagnosis. So this is a screenshot from the Digital Pathologist Facebook page, where we currently have over 2,500 followers. And this is a screenshot from the Digital Pathologist Twitter page, which was created at the initiation of this project, and in just a short time has accrued over 240 followers. So these screenshots represent 2 of the cases that were posted. The red boxes indicated Z-stacks, and the black represent the higher magnification scans. So you can see the flexibility of the system in terms of scanning regions of interest at higher magnification and for regional Z-stacking. This is an example of the Case of the Week Google form that was linked to each case. The user had a link to the Panoptiq web portal, and a quiz question was available to be answered after reviewing the slide. As the administrator on the Google account where these forms were hosted, I was able to see metrics on the accuracy of question responses. So this particular case at the time had just shy of 40% of user responses who chose the correct answer and correct diagnosis of being a metastatic melanoma. So to show the results of the followers after 20 weeks, on Facebook this increased by 135. Total today, as just mentioned, was over 2,500, and on Twitter increased by 186, and most recently was 248. We averaged 36 active weekly users, and also after 20 weeks we generated over 18,000 interactions. And interaction could be a like or share, or retweet, and this averaged over 920 per week. We received these interactions from 32 different countries across the world, and the breakdown of Facebook and Twitter interactions are as follows there. And Twitter had a larger user response than Facebook from sharing cases. So after 20 weeks, there were 217 unique user responses to the questions that were linked to each of the posted cases. And of those total responses, 64% of users answered the quiz questions correctly. So I guess I've been making some of the quiz questions somewhat difficult, but the main focus was to provide educational material in pathology to be shared. So with that, I'd like to thank you all for your attention and hearing about how UPMC and other departments have utilized the Panoptiq system in pathology, and would be happy to take any questions.
Great, thank you so much, Dr. Hanna. It was very interesting to see the use of Panoptiq and the portal on Facebook and on Twitter. It's been very interesting to kind of been following that and helping you through that. I'll see if we've got some questions yet. Let's see, we've got something here. We have a question about how many Panoptiq systems are currently at UPMC. Is this been widely deployed within UPMC, or is this a system that is being shared currently?
So we currently have a system that is being shared, but very easily these could be deployed at every pathologist workstation, since it doesn't ultimately take up a large space. However, at UPMC there is one that is shared by all the users.
Yeah. So, yeah, to kind of follow on that, this is certainly a system that could be on every pathologist microscope. You're certainly used to having a camera in many instances for creating snapshots, etc. This is really an extension of that. So we sort of believe, you know, if pathologists are used to creating snapshots, and if that's very common to be doing yourself from your desk, why not give the pathologist the ability to create a wider image, or panoramic image of the slide, you know, larger field of view, really for tumor board purposes, consultation or whatever. I don't think Panoptiq would be is meant to be as a replacement for a whole slide scanner. You know, in terms of volume, there's many times where that would be the preferred use. But even within institutions that are, you know, mainly digital, there's bottlenecks, workflow issues with getting, you know, a slide imaged in an ad hoc fashion. So giving this ability back to a pathologist or to a technician to do from their own desk can really round out the implementation of digital pathology in an institution. So another question I have is this, if a slide is scanned to the portal, how is it protected? So the portal is hosted by Amazon Web Services. It is fully secure, and for any institution, a BAA can be signed to make the system completely HIPAA compliant. It is currently HIPAA compliant in terms of the security protocols and the logins. And of course, what we would still recommend is really to not have any issues around HIPAA compliancy at all, is to keep cases coded with numbers and accession numbers, and obviously just trying to not put any personal health information or identifiers in the portal itself. Could you expand, I have a question here as well, could you expand on the use of this system in your consultation service, if applicable? Do you feel there's limitations for its use in a community hospital? How could you see this in consult then?
So we've predominantly been using the Panoptiq system for educational use cases here, as well as the frozen section publication, but it very easily could be used in a community hospital. Ultimately, for laboratories or departments with low to medium volume cases that they would like to send for consultation services, this could act as a whole slide scanner where it's attached to a microscope, and either a pathologist or technologist can scan the case, upload it to the portal, again de-identified, and send it to a consultative institution.
Great, yeah. And that's certainly a great use case for Panoptiq is at the community hospitals, where there just wouldn't be the volume to justify purchasing an expensive whole slide scanner. You know, it allows them to digitize slides and, you know, where possible, be submitting digital scans to larger consulting institutions like UPMC, for example, instead of, you know, having to cut more slides from the tissue block and have those shipped. So there's a lot of time and cost savings to having a Panoptiq system at a community hospital. Another question is, can we create JPEG TIFF snapshots using Panoptiq? So absolutely, we can do that either directly from the live view or within the within the review mode, or even within the portal. We can take a snapshot of any region, you know, of any size to cover the slide as well. So yes, to follow on to your question, Panoptiq can completely replace the current camera on your microscope. Another question is, how are the images managed? Is there a PACS-like image management system in place? So our PACS-like image management system would essentially be the portal. You know, I can go back and show you. It's not linked together. You know, that's still a lot of work that's being done in digital pathology as a whole, is how all of the systems will be linked together, how image storage works, etc. We've, I guess, taken a small time stab at that to allow storage of scans on the portal. So within the File Explorer, there's access to all of the scanned images. And what you could do, if your LIS allows it, or your other forms of electronic health records, there would be the ability to embed the links to the cases, so that by clicking a link within a patient record, you would be able to see the associated image. The nice thing about that as well is you wouldn't have to necessarily, well, you wouldn't put any patient information on the portal. the patient information would still be contained within your hospital network. The portal is essentially, in that case, just acting as a viewer for the scans. Is there the ability to annotate or ask questions, for instance, on a frozen section if there was a question about a region of interest? So we can, or I'll go back to here, so we can add annotations to any area, and I'll put atypical cells. For example, you can have this communication going back and forth. You could also be writing notes back and forth and having this as a bit of a communication log on a scan through the portal as well. So the portal is web-based, so it is currently on Amazon Web Services. I think there's a question here about permitting shareability in the domain network. I'm not entirely sure what that question means. Like, if that means could the portal be ported into a hospital server so that it's all kept internal? I'm not 100% sure on the answer of that question. I would be most happy to get back to you on possibly how that could be implemented. So definitely, if there's anyone out there who would be interested in how Panoptiq could be integrated into their LIS or into your hospital network, if you're interested, definitely let us know, and because we're kind of searching out clinical partners that we could work with to drive through this implementation with an LIS. So do get in touch with us. We'll also be at PIS in Pittsburgh, the upcoming show for the API Summit. We'll be there at booth B1. So there's a question here I'm just going over. I think I missed one. Any experience on microbiology, gram stain, and urine micro? I'll pass that back over to Dr. Hanna, maybe.
So there was a presentation prior, and if this presentation is being sent out, you can review it as well. However, Panoptiq has been used for microbiology, and actually it's probably one of the better systems for it because it leverages the microscope and the optics there, where you can see the actual gram stains and cocci or otherwise while you're scanning the slide, so you can ensure the best resolution captured image. And the same for urine crystals or urine micro, where you're able to capture those images with the highest resolution. And I'd say this is probably where the Panoptiq system outperforms some of the other systems.
Yeah, great. So we really help with those use cases that whole slide scanners, just can't quite do on their own very well. Being microscope based and being able to create a scan with any magnification of objective really means, if your microscope can see it, then we can image it and produce a whole scan. So I have a question here about, is there a communication framework within the system? Can you see if people are online, if they can be pinged to view a frozen section? Like I said, we're developing the system to be sort of peer-to-peer streaming, etc. we would certainly be open to suggestions. You know, this is sort of in the planning phase, and how we would develop new features here. So I would love to get back to you or anyone else who would like to maybe get involved in providing some feedback or input on how we can make this system fit all of your clinical needs. So, you know, do get in touch with us if you would like more information about purchasing the system or having a demonstration of the system. We have a good dealer base throughout the US that we can certainly put you in direct contact with, and also myself. So please, thank you again for all your questions, and certainly welcome any additional questions that you may like to send to us. And I think with that being said, you know, we can probably wrap things up, and unless there's any sort of last minute questions that you would like to send in to us. Otherwise, I will again say thank you very much to Dr. Hanna and to UPMC for all their support of ViewsIQ and the Panoptiq system. And we look forward to seeing many of you at upcoming shows and conferences, and hopefully some demonstrations at your institutions. All right.